This video is about rotator cuff tears and rotator cuff surgery. Typically when patients come into my office with concern for a rotator cuff tear, they'll come in with either pain and or weakness of their shoulder. Sometimes this can be an acute injury, but most of the time actually this is more of a chronic occurrence and the patient can't specifically remember one exact episode. The number one symptom of a rotator cuff tear would be pain while sleeping and some type of night pain associated with the shoulder. The patient can also have pain with activities, and based on the tear, some patients can have pretty significant weakness with the shoulder. When a patient comes to my office, we'll start out with x-rays of the shoulder, which can first show us if there's any arthritis in the shoulder. It can also show us the position of the humeral head or the ball of the shoulder and how it's sitting in the socket. And that can clue us into any possible rotator cuff pathology. We'll next do a very thorough exam in which we measure the range of motion of the shoulder and then also the strength of the various rotator cuff muscles and tendons. A lot of times we will start with initial non-operative treatment, which would include anti-inflammatories, Tylenol, physical therapy to work on strengthening of the muscles around the shoulder, and sometimes a steroid injection around the shoulder. If this does not completely resolve the symptoms, the next step would be to get an MRI to look at the soft tissue structures of the shoulder, and that's how a rotator cuff tear would be formally diagnosed. A lot of patients can compensate well with a rotator cuff injury and not all the time require surgery. However, most of the time when there is a full thickness tear, that is not going to heal on its own, and so the recommendation is typically for surgery. The surgery is an outpatient surgery. This is done arthroscopically through tiny little poke holes in the shoulder. When we are doing a shoulder arthroscopy, we'll look at all the structures of the shoulder, take care of any pathology within the shoulder in addition to the rotator cuff tear. With all of my rotator cuff repairs, I recommend treating the biceps tendon. So the biceps muscle has two tendons associated. One of them attaches outside of the shoulder and one of them attaches inside the shoulder joint. This biceps is a big pain generator in a lot of shoulders, and it also lays right under the rotator cuff, so it oftentimes gets in the way of a repair. Even if the biceps tendon isn't bothering a patient, it could get entangled in the repair and then become symptomatic. So for that reason, I recommend addressing the biceps tendon. Biceps tendon can either just be cut and removed from the shoulder, or it can be cut and removed and then reattached. There's different advantages and disadvantages to each of those, but that would be discussed on an individual basis. After the biceps tendon is removed, the rotator cuff is then repaired back down to the humerus using various suture anchors and different types of passing devices in which we pass suture through the tendon and then attach it down to the bone with different anchors. Typically, rotator cuff repair can take anywhere from 30 to maybe 75 minutes based on the complexity of the tear, the amount of retraction associated with the tear, and the overall health of the tendon. After surgery, you will be placed into a large sling, which has a pillow on it, which abducts the shoulder to relax the rotator cuff and help with healing. Based on the size of the rotator cuff tear, you'll either be in this sling for 4 weeks or 6 weeks. If it's a smaller tear, it'll be 4 weeks. If it's a larger tear, it'll be 6 weeks. I recommend being in that sling for most of the day. Now, patients can come out of the sling and they can move their elbow as much as they like, their wrist and their fingers as much as they like, and they can stretch out the shoulder. In general, for those first 4 to 6 weeks, I recommend keeping any movement to where you can see your hand. So I never want a patient to reach overhead where they can't see their hand or reach all the way back where they can't see their hand. As long as they can see their hand, then that's an okay movement. But for the most part, you're in the sling and you're sleeping in the sling. Therapy will begin usually the next day after surgery, in which they'll work on making sure the sling is fitting okay, and making sure that you're moving your wrist and your elbow well, and then providing some light motion in the shoulder as well as some strengthening of the scapula muscles. After 6 weeks, the patient will come out of the sling, and that's when we begin working on motion. My goal is for patients to regain full motion by 10 to 12 weeks post-op. And that'll start with passive motion, in which the therapist is moving your shoulder for you, and then eventually will be active motion where you're moving your shoulder in all directions. Once full motion is regained at 10 to 12 weeks, that's when we begin strengthening. In general, for full healing and full strengthening to occur, you're looking somewhere between 4 and 6 months, depending on the size of the rotator cuff tear. After that time period in which full strength has returned, you would then be allowed to return to all activities with really no restrictions. In my experience, typically one of the last things to improve is actually that night pain or that sleeping pain. And that'll usually happen towards the end of the recovery process.